Good afternoon, everyone, and welcome to the Memphis and Shelby County Joint Task Force update. I'm Alisa Haushalter, Director of the Shelby County Health Department, and as we've been planning for going back to school, we thought this was a good opportunity to ask Dr. Jon McCullers to join us again to really go over some things that parents want to consider as children go back to school. So I'll give a brief update, then I'll turn it over to Dr. McCullers, and we'll take questions thereafter. As of this morning, we have 20,382 cases. That's an increase of 326 cases from the day prior. I do understand that people have calculated the daily positivity rate, so I want to caution people about looking at the day-to-day positivity rate, in part because we continue to get specimen reports in that represent multiple different days. So while we only received a little bit over 600 reports and over 50% of those were positive, please keep in mind that that's representative of many days of testing and that we focus really on the date of testing. The report day to day helps us determine the impact on our system, how much contact tracing can we do and so on, but it also lets us know whether there are issues with the lab testing system and whether or not there are delays in reporting. Unfortunately, we have 273 deaths, and that's both confirmed deaths as well as probable deaths. And then a few other things that I wanted to highlight is that our positivity rate over the past week is a little bit over 14%, but that's actually less than it had been. We were well over 16% for at least 1 week. So I would say that fundamentally, one, we want to thank the community for all the efforts that you're taking, particularly around masking. We do know, and that's proven through the updates given by the University of Memphis, that by mandating masking both through the city ordinance and the health directive, that we have increased mask usage, and we believe that that will continue to reduce transmission over time. But also by closing select facilities like limited service restaurants, we're reducing environments where transmission can occur. As I said, we really are focused on getting children back to school in a safe manner. So I'm going to turn it over to Dr. McCullers to give an update from his perspective, one as an infectious disease specialist and also as a pediatrician, and then we'll open it up to questions. Thank you.
Very good. Well, thank you, Dr. Haushalter, and a pleasure to be here with you this afternoon. I'm Jon McCullers. I'm the Chair of Pediatrics at UTHSC and the Pediatrician-in-Chief at Le Bonheur. And I know the question on everyone's minds right now is, what are we doing about schools and about kids going back to schools? And probably the most commonly asked question we're getting right now is, should schools be open? Should schools be closed? Should parents send their kids to school? Should parents keep their kids home? And what we can say to that right now is we're in a status as a community where we have high levels of community transmission of this virus. What that means is, from my standpoint, there is no good answer to this. We know that if kids go back to schools, we're likely to see transmission within the schools, perhaps transmission onto faculty or staff, and perhaps transmission back into the homes to parents or grandparents. So we know that there are health issues associated with the decision to open schools and for parents to send kids back to schools. At the same time, we also recognize that having kids in school, having face-to-face learning, is the best way for kids to learn. It's very important for their socio-emotional development, very important because that's where they get a lot of nutrition in terms of school breakfast and lunch, as well as their physical activity through the PE programs. We also know that kids learn better face-to-face and when they're there with their peers and can interact in that way. So I think both choices both choices may be bad right now. Keeping kids from home, we know that there's going to be issues with that. Sending kids to school, we know there's going to be health issues with that. So from that standpoint, and from the standpoint of being a physician and an educator and working with UT and Le Bonheur, our advice right now is that it is really incumbent on the school systems, on the schools themselves, and on the parents to make those individualized decisions. Some schools may be better able to deal with virtual learning than others. Some may be better prepared to have in-person learning because of the facilities. On the parental side, some parents may be better equipped for virtual learning, and some may need to send their kids to school because of issues with childcare and the need for nutrition and so on. So I think an individualized approach to this is best. So over the last 3 or 4 weeks, we've had significant questions being directed to Le Bonheur and to UT from schools, from school systems, as well as from parents. And about 3 weeks ago, we decided it was incumbent on us to really step into that gap and start to help to answer some of those questions that were being asked and that, may be covered in national guidance or state guidance, but because there's so many permutations and this is such a complex issue, really required some local expertise. So we formed a few weeks ago a back-to-school task force at Le Bonheur, composed of Le Bonheur and UT faculty, as well as Le Bonheur educators and community health advocates who have a great deal of experience working with schools, working with children with developmental disabilities and other special issues. And we tried to address 4 different areas where we thought we could provide some medical advice, some special advice that would be helpful to schools and to parents. The first of those was communication. How do we best talk to the schools? How do we get this across to schools and to school administrators, as well as parents? How do we get information out to parents in a way that's useful for them? The second one of these is one of the clear things we heard from schools was a desire to have some policies and procedures and to have them in written form, something, a protocol that schools could follow, could refer back to, and that really went into some of this detail for our local system that maybe the national guidelines can't really address. So we have a group that has put forward that guidance. The third area really is looking at infection prevention. What do we do about positive cases in schools? Can we develop some defined algorithms that say, this is what you do, this is how you work with the health department, this is how you work with medical providers to deal with positive cases among kids or among faculty or staff, and to be able to walk schools and school officials and teachers through that. And the fourth one was really dealing with kids themselves. And when we have kids who have some special conditions, maybe chronic medical disease, maybe are medically fragile, how do we deal with those kids in a school setting? How do we best enable them to learn? And if we're talking about kids with special needs, how do we adapt the school system and the learning environment to them? And where can we be helpful in that? So Le Bonheur has done a couple of things along those lines. The first is these task force, these subgroups, have put out a document earlier this week, and it can be accessed on the Le Bonheur website, so www.lebonheur.org/coronavirus. You can find this entire large set of guidelines that we've made available to the schools. Parents obviously can access it as well. It's really written for the schools and for school administrators, but has a lot of information in there I think would be useful. The second is we've started a series of webinars. We had a webinar this morning with over 200 school officials. We had one 2 weeks ago with school officials, and we're using this as really to connect to the community and be able to answer specific questions that come up both in general and now about the specific guidelines that we've put out. We hope to continue those webinars throughout the school year, maybe every few weeks or once a month, as a way to really to get together with the school officials and be able to ask specific questions and get some guidance out there. We anticipate we'll be updating the written guidance as we learn. I think there's a lot we're going to learn from the frontline teachers, from the administrators, of how we're going to have to evolve and maybe change some of those guidelines as we get more into the school year and start to understand some of the issues. We want to be a source of trusted guidance. We're not the only source of guidance. We recognize that the state of Tennessee has also put out guidelines that very closely adhere to what we're doing, and we're working very closely with the health department to make sure that what we put down and what we advise is in concert with the guidelines that they're putting out as well. But we wanted to be able to be that trusted source of information, and throughout this pandemic and throughout the school year, we intend to again be able to offer ourselves to parents and to families as well as to the educators to help on this matter. So we'd be happy to take any questions, specific questions about that that I can address. But again, the website for that is www.lebonheur.org/coronavirus, and the guidelines are posted up there right now. Thanks.
Omer Yusuf, Daily Memphian.
Hello, can you all hear me?
Yes.
So my first question is about the positivity rate today. I know you said that it's specimens over multiple days, but so do we expect more days with a high positivity rate like today?
That's always possible. Really, my point was to not look at the day-to-day positivity rate. We want to look at positivity rate over time. Usually we look at it over a week and compare that to previous weeks and whether it's trending up or trending down. But the other key takeaway is that we continue to have lags in reporting from the laboratories, and that when we get a bunch in, sometimes it's representative of the fact that a lab has been able to process specimens that were sitting there for several days. So in looking at the data, really look at the date of collection. That's a better representation of our positivity rate from week to week. Do you have a follow-up?
Yes, and my second question is for both you and Dr. McCullers. So where do you stand on high school sports as far as the contact, and with the news of course, the state this week's talking about that? Where do you two stand on that issue?
So we do think there are inherent risks, particularly in contact sports. As far as process, we're waiting for the governor's executive order to review the language in that order. Both Dr. McCullers and I are on the Back to Business group. We've agreed that we will huddle fairly quickly and issue a more formal statement after we have the exact language from the executive order. But I'll turn it over to Dr. McCullers to make some additional comments.
I will echo Dr. Haushalter's statement there. From the perspective of the Back to Business group, we really want to be reactive both to what the TSSAA has put out and to what the governor will put into the executive order. We have been providing guidance about high school sports as well as college sports all along, but we've been waiting to see what some of the further guidance from the state level has been, and we'll be able to react to that once that is out. Taking off my Back to Business hat and speaking as a pediatrician and from the standpoint of LeBonner, it's very clear from the medical perspective that with the degree of transmission we see in the community right now, it is not safe to go back to contact sports such as football. What level of transmission we need in the community for that to be safe, I can't really speak to, but we don't believe it's safe at this time from the LeBonner perspective.
Sam Hardiman, Commercial Appeal.
Hi, I have a question and then a follow-up. First, about the 610 new test results reported today. Would you attribute that small number, which is the smallest we've had since April 28th, to a backlog at the labs, or does it reflect a reduction in testing over the past couple of weeks?
It's actually a combination of both. There has been some reduced testing capacity, but also there's a backlog within the labs, and we've noted that previously. And your follow-up, please?
My follow-up is, during the months of May and June, the hospital resource data that was released to the task force had about 477 ICU beds that were staffed and available. Over the past couple of weeks, the Memphis area beds have been about 440 ICU beds available. Do we have the staffing to bring those 37 beds or more beds back online?
I think each facility has its own plans for increasing staffing when needed. But what I will highlight, which I've highlighted before, is we have a shortage, particularly of nurses nationwide. And you add on top of that people who may be ill, or they may be quarantined, or they may have taken job opportunities in other states. Many other states have offered very significant packages to get people to relocate temporarily to care for COVID positive patients. So I think we really need to consider the fact that we do have a shortage, particularly of nurses, but also in some areas, physicians and other medical personnel.
Brad Broders, Local 24.
Good afternoon, everyone. First question is for Dr. McCullers. Just for parents out there, what would be your advice about what parents need to know districts are doing to make sure their kids are safe in those districts with in-person learning? And I have a follow-up.
Right, so I think every school district has been putting together comprehensive plans for how they're going to approach going back to school this year. I think it's important to be familiar with those plans, familiar with the details of those plans and how it impacts you and your personal decision making, and then to be in contact with the appropriate school officials to be able to ask questions and get clarifications. As I said in kind of the introduction, this is a very individualized decision. One family may be perfectly fine with virtual learning because they have the capability to do that at home and the expertise to deal with the technological side, but another may really benefit better from face-to-face learning. At the same way, one family may have very vulnerable persons in the household, a grandmother with perhaps some chronic comorbidities that might make it higher risk to go back face-to-face and risk transmission coming back into the household, where another may be young, healthy parents that aren't as worried about that possibility. So it's very individualized decision. You need to talk to your school, need to review their guidelines and be familiar with them as possible. I'll also say I expect it to change as we go through the year. This is a big unknown. We're not sure exactly how the best way to do this. I think we'll learn from other school districts and from ourselves locally as we go, and I expect it to evolve throughout the year.
Thanks, Dr. McCullers. And as a follow-up to you or Dr. Haushalter, just specifically for parents out there, could you give any guidance on distance of classrooms, cleaning supplies you believe are necessary, any specifics you might want to provide that parents should be aware of for their kids?
Yeah, so the Shelby County Health Department, as well as the LeBonner guidelines that have come out, have pretty strictly stayed with the CDC guidelines for schools. And so we're recommending that all schools that go back to in-person learning, that face-to-face learning, practice social distancing in the classroom, so at least 6 feet between the kids at all times and 6 feet between the kids and the instructors at all times, and that everyone wear a mask or a face covering during the school to the extent possible. Obviously, there's sometimes you might have to take off the face covering, such as when eating, but for the rest of the time in the school, we want to see a face covering. Now, I'll note that there is, differing guidance out there across the nation. The American Academy of Pediatrics, for instance, has said 3 to 6 feet may be acceptable in some circumstances. But in Shelby County, I think there's a strong sense from both the health department and from the medical professionals that it's 6 feet plus a mask.
Kendall Downing, WMC.
Hey everyone, this question is for Director Haushalter. I was wondering if, kind of two-parted question, but the same topic. I was wondering if you could react to the decisions that have been released by 2 federal judges in support of the health department's position on closing limited service restaurants, and if you could also comment on the letter that some full-service restaurants have sent to the health department asking for bar seating availability and some of the time constraints to be moved.
So I'll start with a few other comments and talk to those 2 items specifically. In the state of Tennessee, we don't have licensure for bars. So we did make the decision to close limited service restaurants. There has been a lot of questions about what is the data locally that would implicate that transmission is occurring in those facilities. And in public health, we actually need to learn from other communities as well. So we have evidence from many other communities across the country that particularly for the younger age population, 25 to 45, but now our cases are really 18 to 45, that social settings such as bars are very high risk locations for transmission. So we made the decision clearly to take much more of a laser-focused approach, which was to focus very closely on a high-risk transmission environment, bars, limited service restaurants. However, what happened, and we always get feedback, is that we received a lot of feedback that Beale Street, obviously what we knew was exempt because of its zoning, but there was still continued activity on Beale Street specifically that was bar-like activity. And when I mean bar-like, it's people were under the influence of alcohol, not wearing masks, more likely to be louder, less likely to social distance, and so on. We also received information that within restaurants that had bars, even though we were allowing service for food at those bars, that they were actually becoming a proxy for limited service restaurants. So we did have to expand our decision and say that even bars within restaurants at the current time could not operate. We will revisit that, but that gets to the letter that was sent to me, but it was an open letter to the public. And there were really several key messages there. One, that there are some independent restaurant owners that believe that the current association does not necessarily represent their unique views, and they wanted to share those views with me. But also they specifically wanted to revisit sale of food at the bar counter if they adhere to social distancing and all of the other recommendations. I did reach back out. I will meet with the group. I had actually told a reporter previously, I'm always happy to have dialogue with others to better understand their unique circumstance and look for opportunities to continue our economy and moving forward, but also to do that in a safe manner. So we will be meeting and we'll move forward from there. And then in the interim, we've already had meetings with the Memphis Restaurant Association, and I'll continue to have contact with the association as well. Ultimately, our goal is to reduce transmission in the community, but to do that with as limited amount of impact on society and economics as we possibly can. In regards to the ruling of the judges, I think it's fairly straightforward, and all of you have been reporting on that. There were some businesses who thought that there was overreach from government in our decisions. But as was decided by the judges, there's a lot of latitude for public health authority in the event of an emergency, particularly a pandemic. And so, again, we're always open to feedback. We've received that feedback, but we do have to make the decisions necessary to protect the public's health. And then lastly, I just want to reinforce process, because I do believe that there are some people who have not really been as familiar with public health. So in public health, we say, if we do our jobs well, you don't know we exist. You expect clean water, you expect clean air. You also expect to go out in public and not become ill because there's rampant infectious diseases. But we really don't sit in our offices and arbitrarily make decisions. Within Memphis and Shelby County, we have had a very robust process that has occurred through the Joint Task Force, and particularly the Back to Business group. There's representation from not only public health, but clinical academic medicine, as well as legal opinions and administrative opinions. And discussion occurs within that group so that we can hear various perspectives before we issue a health directive. And then I also have contact with all of the mayors from the city, the county, and all the municipalities. And I'm always sharing along the way our findings from the data as well as actions that we need to take. So I do believe we have a robust process locally, and that we do recognize decisions that we make do have an economic impact and a social impact, but ultimately we have to assure that our community is healthy and safe, particularly from COVID-19.
Kendall, did you have a follow-up?
Yeah, just quickly, I was wondering if we've gotten some questions about the phases. I think on paper we're still in phase 2. Are we still sticking to that phased approach, or are we just kind of, adding conditions along the way to phase 2? Is phase 3 still an option at some point down the line? Thank you.
That's a great question. Initially, we did have the 3 phases in the Back to Business group, and that was consistent with national phasing. But what we've recognized as we've moved along is that we have to make, say, more carved out decisions. So we remain in phase 2, and ultimately we could say we're in phase 3, but always the document that you need to look at is the health directive. And we are really striving as a group, Back to Business group, as well as elected officials, to make very laser focused interventions so that we don't have a complete shutdown. And with that noted, then we'll probably be in phase 2 for a significant period of time, but you will see that as a group we approve some activities, and then in other cases we make decisions like closing the limited service restaurants to be more tailored and to have less impact overall.
Dominique Dillon, Fox 13. Dominique Dillon, Fox 13. we'll go to Greg Akers, Memphis Business Journal. Greg Akers, Memphis Business Journal. We'll go to Jane Roberts, Daily Memphian.
Director Haushalter, could you tell us if there have been some irregularities in the number of false positives or false negatives lately? We've had reports that people were tested twice and got different test results.
So from our end, what we receive are the positive and the negatives, and one person only is accounted for once in our system. So at the current time, I have not heard that there were increases in the percentage or number of false positives or false negatives. Keep in mind that an individual may test positive and subsequently test negative for whatever reason. It doesn't necessarily mean it's a false test. It may be where they are in the course of their illness and recovery, and that people, particularly we've found that people are getting tested when they're contacts during the quarantine period, which isn't absolutely recommended. People can do that if they so choose, but they may be negative one day and positive the next day. So I would say that, one, we haven't heard that there's an increase in false positives or negatives, and each case is unique, so that we would have to look at a unique case before we made any specific decisions or recommendations.
May I ask a follow-up, please?
Sure.
What are you seeing in the Hispanic community as far as people using folk remedies for COVID?
That's a great question. I actually don't have any updated information on use of folk remedies in that particular population, but I can assure you after I leave today, I'll start asking some questions to see if there's any information that I didn't have previously.
We'll try Dominique Dillon again with Fox 13.
Have any updated information on use of folk remedies in that particular population?
All right, let's go back to Sam Hardiman with the Commercial Appeal.
Dr. Haushalter, this question's for you. You've mentioned a couple of news conferences now the need for even more contact tracers. You've thrown out the number of 250. Where are we on moving forward on enhancing the amount of contact tracers we have, and what is the number we're going to settle on, and how do we pay for them?
So I would first say we're not going to settle on a number. We have to constantly look at our public health capacity, just like healthcare systems have to look at their capacity, and looking at specifically what are our needs, not just in contact tracing, but also in surveillance and epidemiology. We have to have data to drive decision making, so we have to make sure we have strong capacity in that area. And we also have to make sure that we're doing a much better job at community outreach and education. So we'll look at all three of those areas, and I won't settle on a specific number of team members as long as we have the pandemic. We'll continue to adjust that based on the needs of our community. At the current time, though, the recommendation that I've made to Mayor Harris is we need to try to get up to approximately 250 individuals that can assist with contact tracing. But I want to make a few comments about contact tracing, because while we have to do the case investigation, identify the contacts, and notify the contacts, isolate and quarantine, we also are looking for barriers that keep people from staying in isolation or quarantine, which is much more case management. For example, we may have an individual who needs housing, so we have to have that team member dedicate the time and resources to get that person housed. So a minimum of 250 currently. We're looking at a variety of different ways to onboard 250 additional team members. With our first COVID response team of 140, those are all Shelby County employees. In addition to that, the city has for some time loaned about and up to 60 employees at any given time. Many of our health department employees were also reassigned to COVID response. So we'll continue to have some employees that are reassigned. We'll continue to have volunteers. We'll continue to have some students. This is a really good experience for medical students, nursing students, and public health students. But we're also looking at potentially working with an agency to have that agency hire individuals who could provide assistance. Lastly, we previously ran 2 shifts every day, a morning shift and an evening shift, because we had such large numbers of cases coming in. We went back to 1 shift a day, 7 days a week, but we will likely get back to 2 shifts again in the near future. That allows us to have some individuals work morning and some evening, but that also would allow us to have some part-time individuals. Your last question was, where does the money come from? At the current time, we really are relying heavily on CARES Act funding, but also within our other programs where people have been reassigned, there may be local funds that have funded those positions or grant funds that have funded those positions. But we'll still have to rely heavily on federal funding at the current time and advocate for additional funds as needed.
Go back to Greg Akers with the Memphis Business Journal.
Hi, I wanted to see if there is a status of the release of details about the Tripwires.
We've been working on the Tripwires. I actually had another meeting today with the mayors, an extensive meeting with Mayor Harris, and received additional feedback. So we're working on that. The goal is to try to have the document ready for tomorrow late afternoon. But again, we want to incorporate all the feedback that we've received. But I also wanted to clarify the role of the Tripwires document, whether we end up calling it Tripwires or levers or something else. The purpose of that document is to have some metrics there that we know as a community that when we reach those metrics, the health department is going to change its health directive. I think there are times when people believe that we just out of the blue made changes, but typically we've been talking about those along the way. So this will be a good way to cue the public that if we reach a certain threshold, there are certain actions that will be taken. The other is that there will be some areas where there are recommendations, and they will be very laser-focused recommendations, but they may not be a directive because we don't have the authority to give the directive. I also want to reinforce that this document was well informed by the Back to Business team, elected officials, and key other individuals on the task force, including Dr. Jane, who is also a consultant with the city, but not on the Back to Business group. So more to come, and ideally we'll have that ready by tomorrow afternoon.
We are out of time. Are there any closing messages?
I just want to reinforce some things that Dr. McCullers said. Returning to school really is an individual decision. So please look at your school system's return to school plan. Ask questions of your school leaders as you need to. Really look at your own family and your unique needs of your family and your children to make informed decisions. But I would also add, ideally each of you has a healthcare provider for your child. So if you have specific questions about the unique needs of your child, always remember to consult your healthcare provider, and then access resources through the LeBonner site so that you can have that information in front of you. Thank you.
Thanks, everyone. We'll see you next week.